Hello everyone, my name is Marina and today I am going to talk about gastroesophageal reflux disease, its definition and also the clinical aspects of this pathology. Now, what is gastroesophageal reflux disease? It is a common condition in which the stomach contents move up into the esophagus and then reflux becomes a disease when it causes frequent or severe symptoms or injury to the esophagus, meaning it damages the esophagus. Now I'm going to present you some aspects regarding the healthy esophagus in comparison to the pathological esophagus, meaning the esophagus that is affected by the gastroesophageal reflux disease. Now, normally, when you eat, food travels from your mouth through your esophagus and reaches a door-like structure called the lower esophageal sphincter. And this structure opens to allow food into the stomach and closes to keep the stomach contents from entering the esophagus. Whereas in the pathological esophageal structure, the lower esophageal sphincter relaxes due to some conditions and the stomach acidic content, it refluxes back in the food pipe called esophagus. And that causes the heartburn or the burning sensation that we feel. Now, what are the causes and the other symptoms related to gastroesophageal reflux disease? Well, the causes may mostly be related to foods that we are having. So, peppermint, chocolate, anything related to caffeine, alcohol, and acidic or especially spicy foods may affect us. And also, pregnancy or having a hiatal hernia may cause the reflux to become pathological. Symptoms include that heartburn that we've been talking about, so the burning sensation in your chest that usually happens after eating, and it can be worsened by lying down, or it can be even worse at night. Now, the regurgitation of food may even happen, and upper abdominal or chest pain, and also the sensation of a lump in your throat. Now, regarding the diagnosis and the treatment, it's important that the patient has a presentation that's typically overnight individual, burning retrosternal pain and heartburn, and it's exacerbated by bending over, wearing tight clothes, lying flat in bed at night, and it's relieved by antacids or H2 blockers. Now, the management includes a lifestyle modification and also medical treatment. So, regarding the lifestyle modifications, we have to prevent spicy foods, especially those, and eat 3 hours before sleep, elevate the head before sleep. And regarding the medical treatment, we can have PPIs or H2 blockers, of course, or antacids. Endoscopy and biopsy are important to rule out dysplastic changes. Also, fundoplication or surgery if dysplasic changes occur are taken into consideration as a treatment. Now, fundoplication is basically a surgery in which the surgeon wraps the upper stomach around the lower esophagus. Now, it reduces the amount of acid that enters the esophagus from the stomach, and this procedure can eliminate gastroesophageal reflux disease symptoms that are not relieved by medication. And also, the fundoplication as a procedure is happening by making a wide incision into the patient's abdomen to expose the stomach and the lower esophagus, and then the surgeon will wrap the upper portion of the stomach around the esophagus, creating a pressure on the lower part of it. Now, to get more into detail regarding the surgery for the gastroesophageal reflux disease, this surgery is appropriate in long-standing symptomatic disease that cannot be controlled by medical means. And of course, it is necessary in anyone who has developed complications such as ulcers or even stenosis, and it is imperative if there are severe dysplastic changes. For the latter, resection is needed, but in all the other cases, laparoscopic Nissen fundoplication is the usual procedure that is taken into account, as you can see in the image that's listed above. Now moving on to the clinical cases, and because we have various patients and we can encounter either a vague symptomatic clinical case of gastroesophageal reflux disease, or on the contrary, a patient with the classic clinical features of gastroesophageal reflux disease, we have to try and diagnose all of them either way. So let's begin with a 75-year-old man that came with a history of epigastric and substernal pain that he cannot characterize well, so the symptoms are quite vague in here. Therefore, we cannot make our diagnosis until we rule out some other medical causes related to the epigastric pain. So we performed an ultrasound for the gallbladder and everything looks normal. We did an EKG for cardiac issue and cardiac enzymes and everything turned out all right. So there's no sign of myocardial infarction. Now, what we should do is that we should monitor the pH levels for about 24 hours. And if the pH is low in this patient, then we have our diagnosis confirmed, the diagnosis of gastroesophageal reflux disease. Now, on the other side, we have a classic presentation of this disease. Now, just suppose we have a 65-year-old person, an overweight one, an individual that complains of burning retrosternal pain and heartburn, and that burn is exacerbated by bending over, wearing tight clothes, lying flat in bed at night, and is relieved by the specific medication, the antacids, the H2 blockers. Now, the long-standing history, the damage to the lower esophagus, the peptic esophagitis, or the Barrett's esophagus have to be ruled out with endoscopy and biopsy performed, but especially to rule out the dysplastic changes like the Barrett's. Now, if any of the dysplastic changes occur, then we do the resection that we've talked about. Now, thank you so much for listening to gastroesophageal reflux disease, and we cannot wait to surprise you with even more medical videos and medical content on MedWay YouTube channel. Don't forget to subscribe and give us a thumbs up.